Welcome to Look and Feel Your Best with Dr. Patrick Flaharty. Dr. Flaharty is the medical director at Azul Cosmetic Surgery and Medical Spa and the only dual fellowship trained facial, cosmetic, and ophthalmic plastic and reconstructive surgeon in Southwest Florida. Dr. Flaharty will spend the next half hour giving us great suggestions and some thoughtful ideas on how to look and feel your best. Hello.
Hey, Carly.
How are you today?
Great. Nice to be here.
Yeah, I'm excited to chat with you today, and this is a great topic. Today we're going to be talking about the eyes, which is really such an important feature, I think, from top to bottom. I mean, people look at your eyes. That's where you start, right?
Right. And for me, that's where I started it, in ophthalmology and then eye plastics and eventually facial cosmetic work. But eyes still remain one of the most important things that we do and that I do. Eyelids age faster than the rest of the face. We tend to see wrinkling and crow's feet and some hooding around the eyes even in the 30s and 40s. And so we often will see some of those aging changes around the eyes before we see them elsewhere in the face.
Why is that? I mean, I'm assuming the skin is kind of thinner there and more delicate. I mean...
Right. Yeah, the eyelid skin is the thinnest of the face, and so it tends to wrinkle faster, unfortunately. And of course, the eye itself is a very delicate structure. The lids serve a very important purpose of protecting the eye. And so it's really a delicate anatomic structure, the eyelid. It's very, very thin, but has multiple layers that are responsible for tear production and protection of the surface of the eye. And it's also interesting to know that when we meet people, our eyes tend to track to their eyes and the area around the eyes more than any other part of the face. So clearly it's an important point from the standpoint of evaluating recognition of a face or even beauty of a face. We tend to focus on the eyes when we meet others.
Now, when it comes to aging of the eyes too, men, women, kind of, is it the same? Do we age as fast, as equally as fast?
Well, yes, I think that's true. I think, again, genetics plays a role there. There are people who come in sometimes in their 30s with really heavy eyelids and they say, yeah, these are my dad's eyelids or my mom's eyelids. So, unfortunately, the genetic cards we don't control, and that's a big part of it. I think men and women tend to age pretty equally around the eyes.
I'm thinking with women, though, we're constantly putting makeup on, maybe we're touching them more, I don't know. I mean, that doesn't speed up the aging process?
That's true. I think rubbing the eyes, like if you have allergies or a condition like that that would cause you to, rub the eyes a lot, that can lead to more wrinkling. And, I think probably women become a little bit more concerned about wrinkles, where men, it's kind of a rite of passage to have some crow's feet and maybe aren't that concerned about the wrinkles around the eyes at that early age.
So what are some other things that we see that go on with the eyes kind of early on, or some things that people tend to notice right away?
Yeah, so I think the first thing people often notice will be crow's feet around the corners of the eyes, or just heaviness of the upper eyelid. People will say, gee, I have a hard time putting my makeup on because the skin is drooping over the lid and they're having to pull their eyelid up in order to put makeup on. And so some of the extra skin and folds of the upper eyelid, sometimes that can be caused from the eyebrow drooping, so that's always something we assess when we're looking at eyelids. But the eyelids, because the skin is so thin, it does stretch easier, and so we start to get redundancy and extra folds, and that often shows up with sort of a heavy upper eyelid or extra wrinkles or folds in the upper eyelid.
Well, and I can imagine that can be an issue for vision as well. Do you see that a lot with your patients?
We do, and it is the one area of facial surgery that sometimes insurance will cover, because if your eyelids get so heavy that they're weighing down the lid or drooping over the lid, they can actually interfere with peripheral vision. And so removing some of that extra skin can get rid of the hooding and heaviness and open the eye and help you see better. Well,
and we were talking about how important the eye is, certainly for our facial features. I think that's why it's even more important to make sure you go to an experienced doctor who, when you are going to have something done, it's a very important issue around the face. We need to make sure it's done right.
Yeah, I think the whole field of ophthalmic plastic surgery developed from a group of ophthalmologists who had a lot of interest in the structures around the eye, which is not only the eyelids, but the tear duct system and the orbit, and then developed an area of expertise where people train as an ophthalmologist first, which is an eye surgeon, and then an eye plastic surgeon second, because it is such a delicate area. And it's such an important area for good vision. And when we're doing things like eyelid surgery, we want to make sure we do, the right amount of surgery and avoid problems such as dry eyes or malposition of an eyelid. So those things are really important. So certainly somebody who has a lot of experience with eyelid surgery is the key.
I would say so. We're going to talk about treatment in this half hour as well, but has that changed over the years? I mean, are we doing anything different today, in the medical field than what we were 20 years ago?
Yeah, it has changed, and in some senses, eyelid surgery has gotten a little bit easier, which is good to know. We recognize that a lot of the aging changes in the face are from fat loss, and so nowadays we tend to preserve fat as much as we can because we don't want to create a hollow look. As we age, we tend to lose fat and get hollow, and nowhere is that more evident than around the eyes, where it looks really like a sunken eye. You see the bones around the orbit. It almost has a skeletonized appearance as we get into our 80s and 90s. And so we don't really want to accelerate that because that's not really a healthy, youthful look. And so when we do, for example, an upper eyelid nowadays, we tend to preserve as much fat as we can, remove the extra skin to get rid of the folds, maybe sculpt the fat to enhance the shape of the lid and the lid brow area, but not try to take out a bunch of fat where they end up being hollower 10 years down the road.
Are the eyes one of the first things, if you're looking in a mirror and you're going, okay, I'm not seeing what I used to see 10 years ago. Is that one of the first places that you would start, and if someone's wanting that youthful glow again?
Often it is, because of course when your eyelids get heavy, not only does it, give you those extra folds and some of those changes, but it makes your eyes look tired as well. And so, that's not an appealing look, And an upper eyelid surgery, upper lid blepharoplasty, where we might sculpt out some of the extra skin and maybe sculpt out a little fat to reshape the eye, can give you a very bright, vibrant looking eye. And it takes away that heavy, tired look. So it can really be a real refresher for people's appearance. Just an upper lid blepharoplasty with removing that heavy skin.
Yeah, well, and explain what that is. I mean, is it, because again, you're talking about adding fat and then taking some away. I mean, what is that?
So in the upper lid, the most common thing we do is removing the extra skin of the eyelid. If you close your eyes and pinch your eyelid, you can usually pinch the extra skin that starts to accumulate there. So that extra skin is removed, and that makes the eyelid more bright-eyed and open. Many times you'll start to lose the visibility of the lashes, you get hooded, the eyes just look heavy, and your actual eye is in the shadow of the eyelid. And so the actual color of the eye you don't see as much. I've had patients after eyelid surgery saying, oh wow, my blue eyes are back. And it's because the eye is more open, there's more light getting in the eye, they can see better out, but you also get a better reflection off the iris, and you can see more of the color of the eye.
Is that the most common procedure done? I mean, is there other things that are normally done along with it?
Yeah, upper eyelid blepharoplasty is the most common procedure done. Often there's other things done with it. If somebody has a heavy eyebrow, sometimes we'll do what's called an endoscopic brow lift to lift the eyebrow and enhance that area around the eye. Sometimes people will come in and they'll ask about eyelid surgery, but once you examine them, they have a really heavy forehead and brow, and they really need a brow lift and not eyelid surgery. But sometimes they need both, and so we'll do both together.
Well, and do you have patients that come in and know that they want or need to have eyelid surgery, or do they just look and go, okay, this is not the look I'm after? I mean, how do you normally have to kind of steer them?
A little bit of both. I think, sometimes their eye doctor will pick up on it and say, gee, your eyelids are really getting heavy. Because it's so gradual over so many years, most people don't realize they're losing vision. And so once you've finished and they're like, wow, now when I'm driving I can see the cars around me. And one of the big things people notice is better tolerance for reading in the evening. Because if our eyelids are heavy, we're using our forehead muscles to lift the eyes all day long. And those big forehead muscles, they get very tired, and people get eye fatigue and sometimes even headaches, and then they just don't have much tolerance for reading. And so it's a great benefit of the upper eyelid surgery is to allow people to keep their eyes open longer, read better into the evening.
Again, we're going to talk about kind of treatments and procedures in just a little bit, but is it essentially an easy fix? I mean, is this something that...
That's a loaded question.
Yeah, I know. Sorry for that.
But it is really a pretty easy fix. Eyelid surgery is pretty straightforward. The really good news is there's very little discomfort, so most people are really happy to hear that. But there can be some swelling around the eyes, so you typically have to take a few days off from work because the eyes can be pretty puffy for a few days. In an upper eyelid, we would remove that extra skin and put a little delicate row of stitches in there for about 6 days to help the wound heal. And during the first few days, I'll have people just use a lot of ice packs to keep the swelling down. That's variable, but most people will have, some swelling those first few days, and then that gradually fades over a week or two.
Something we haven't touched on yet is making sure, and I know this is very important for you and for your patients, and having that natural look. You don't want to have something done and necessarily have people know that you had something done. I mean, is this...
Yeah, it's an important thing. The good news about upper eyelid surgery is that you make the incision in the natural crease, and so you don't see the natural crease when your eyes are open, so it's very well disguised. And generally that really thin skin also helps with healing because it tends to heal as a very discreet, either invisible or very fine line that you don't see.
So you're not necessarily changing the shape of the eye, I mean...
Right, not really. We want to enhance their natural eye shape by getting rid of the hooding. You lose part of the vision of the eye because it's hooded under that skin. And so just removing the extra skin allows the eyes to be more bright-eyed and open and less heavy, less tired looking. But yeah, it's not going to change the way people look. It's just going to give them their youthful eyes back.
Yeah, well, again, we still have a lot more to talk about, Doctor. So this is Look and Feel Your Best with Dr. Patrick Flaharty. Stay tuned, and we will be back for the final segment on eyelid surgery with the discussion on the lower eyelids and recovery.
I wanted to look as young as I felt, and Dr. Flaharty knew what I meant. It was so easy and quick, and I did it on my lunch hour. Now I just feel as happy on the outside as I am on the inside.
Look younger today with Dr. Patrick Flaharty. Visit azulbeauty.com or call 239-415-7576. Naples, Bonita Springs, and Fort Myers.
Dr. Flaharty, thank you for giving me my youth back.
I had bags under my eyes for over 30 years. So that's why I first came in. And then I talked to the doctor about my wrinkles because they really disturbed me. I know we're getting older, but I want to get older gracefully. I can't believe how good you look. I mean, all my friends have said that. My old co-workers where I retired from cannot believe the result. I feel like I'm young. I like my look, and I feel more confident in the way I look.
Welcome back to Look and Feel Your Best with Dr. Patrick Flaharty. Today we're talking about the eyes, and we just spent a lot of time talking about kind of the upper lid of our eyes, which is very important. But now let's talk about the lower area. So, there's a lot of issues that can come up there that starts young.
There certainly is. So often people will notice the upper lids because it starts to cause hooding and heaviness and makes them look tired. But simultaneously there are changes happening in the lower eyelid too. And one of the early things we can see is fat pockets protruding in the lower lids, which will show up as bags under the eyes. That's what commonly people call them, or just bulges that make the eyelids makes your eyes look tired. And it's really natural fat that cushions your eye, but it spreads out with age and tends to bulge into the lower eyelids and sometimes can give you these bags that protrude forward and just are unsightly. And so that's one early change. We do see wrinkles of the skin, of course, and those can be more evident in the lower lid and in the crow's feet area. And then we get dark circles underneath the eye, so it's not fair. You get this bulge right under the eye in the eyelid, and then below that, where fat is disappearing, we get a hollow, and that can create a dark circle. And those two things actually accentuate each other. The more hollow you get below the eye, the more the bags stick out. And so all these changes can be unsightly, making us look tired or older, giving us those kind of heavy bags.
And makeup can only cover so much. That's why we're so thankful for you and your team. So what are some things that can be done?
Yeah, I've heard that comment so many times. I've been trying with makeup, I can't hide these dark circles. But the good news is there's more now that can be done than ever before, even non-surgically. So for example, dark circles under the eyes, we can now use fillers to delicately fill in those dark circles, which can correct that in a really thorough way with just a minimally invasive procedure in the office.
Would you do that with swelling? Because when I hear swelling, I'm thinking, I don't want anything else to fill it up more. I mean, what is it doing?
Yeah, so it's a gel that really fills in the hollow, so you have to look at the individual anatomy. So if somebody has just dark circles, like a hollow area that's shadowing, then when you fill in the depression, then it takes away the dark circle. Because most dark circles are caused by shadowing under the eye. And so it's a neat little trick, and it's something that can be done right in the office. And sometimes people have so much hollowness that the bags are showing, but when you fill in the hollowness, the bags now are hidden, and so then you don't see the bags, and that eliminates the need for surgical removal of some of that extra fat.
How soon can you see some of these results? I mean, that's why we like makeup so much. It's instant.
Yeah, fillers are instant too, you know. Now when we put fillers under, we now use a technique called cannula technique, which is really nice. So it's a blunt-tipped, very delicate instrument. We make one little tiny puncture wound, and we can thread this filler in so we can fill in that dark circle and kind of fill in the hollowness around the eye. And you see the results instantly. Now, typically we have patients go home and use a little ice. There sometimes can be a little swelling. With the cannula, rarely do we ever get a bruise. And so it tends to look good right away.
Wow.
Yeah.
How long do the results typically last?
So the nice thing about dark circles under the eyes, the fillers can last a long time, sometimes even permanent. You know, in general, fillers, you know, typically last 6 months to 2 years in the face. But in this area right under the eye, it seems to be a quiet area where the filler, once you get it layered in there in the right amount, it can last many years, which is really a cost-effective treatment.
Is this something that has changed over the years with how we treat these issues as well? I mean...
Absolutely. I mean, we weren't really even using fillers under the eyes until recent times, you know, really the last 10 years. These are all kind of new procedures. And it's sort of driving the field, you know, in every area. It's toward non-surgical, minimally invasive type procedures.
We were talking about the upper lid before. Is this something that would commonly be done, you know, together? I mean...
Yeah, if somebody's coming in for upper eyelid surgery, which is typically surgical, we have to remove that skin to get rid of the fullness. If there's a problem in the lower lid, then we will often address it at that time. So one option would be filling in the dark circle, which we often do at surgery, although that can be done in the office as well. But then the next steps would be, okay, let's say there's too much fat, and there's no way you can hide it with just fillers. So then we have to remove fat from the lower lid. And the way we do that is from the inside of the lower lid, which is really nice because we can make an incision inside the eyelid, remove the fat that we want, sculpt it out, recontour the eyelid, and there's no cutting of the skin at all. So there's no incision on the skin and no stitches. The inside of the eyelid is a mucous membrane. It heals very well on its own, and so people just are on some eye drops for a week or two, and that's it.
Oh, that's fantastic.
Right, yeah.
So I guess when someone is kind of looking to have this done, I mean, is this generally the first place that you start? I mean, is this kind of where you generally look first? Would this be a good first time consideration?
Yeah, well, everybody's eyes are different and
Yeah.
they age differently. So really, there's an algorithm we use to decide what's going to be best. Now, in the upper eyelid, it's fairly similar for most people. It usually is extra skin. Sometimes there's some droopiness of the eyelid, which we call ptosis, that can be addressed. But for the most part, if we don't have a droopy eyelid, we're just removing the extra skin and sculpting the fat. Lower lid is a lot more complex, as we've already discussed, because we have areas that can be too full and areas that can be too hollow. And so we might add a filler to fill in the hollow. We might reduce fat to take away the fullness. And then there's the skin to deal with, and that's another whole issue. And so if there's extra skin, redundancy, then we might trim out a little bit of skin right under the lashes in a way that's very discreet, so you don't see that incision line because it's hidden right under the lash line. But we also have lasers that can tighten the skin and eliminate wrinkles and even shrink the skin to make it tighter and smoother.
Yeah, let's talk about wrinkles because that is a big issue that we face.
Right.
So when there is new treatments as far as lasers as well, I mean, talk about what's available, what can be done.
Yeah, the lasers are great because they are now less invasive, quicker healing time. We can do a light laser around the eyes, tighten the skin, remove the brown spots, remove all the wrinkles, and it just gives you this really tight, smooth, youthful skin immediately. But the new skin does have to heal in because we've taken off the surface of the skin. and so the new skin has to grow back, and that can take 5 to 7 days. So during that time, a patient will be at home using some Vaseline on the skin. They have to avoid the sun.
I was going to say, can you drive? Can you go about your normal business? Or
Sure, with eyelid surgery, you know, as we mentioned, you can get a fair amount of swelling. So the first few days, you're going to probably take it easy and use ice. If you need to run errands, you can certainly put on sunglasses and drive to the store. And so normal activities of daily living are okay, but you will have some visibility. You just need to know your eyes will be puffy. So you don't want to schedule an appointment with a new client the day after surgery, right? But there's little discomfort, so most people function really well in that first week or two while the swelling is subsiding.
Well, and you said that keyword discomfort. That was my next question. How much pain is involved when you're talking about the area around your eye? People may be a little squeamish about, you know,
well, eyelids, of course, are very delicate, but really there's very little discomfort. You know, the key is eyelid skin is very thin. It swells pretty easily, which is, you know, means you're going to have some puffiness. But because it's distensible, it doesn't cause a lot of tension, and so there's not a lot of discomfort. Most patients are pleasantly surprised. There's very little discomfort. We use ice to keep the swelling down. They can take Tylenol if they need it. Rarely does anybody need anything stronger than that.
I know your patients kind of range from, you know, young, old. I mean, is this something that typically you see in younger patients as well? Is this one of the first things that people want done, or how quickly do...
Well, when we talk about surgical procedures and even non-surgical procedures like the dark circles, the answer is yes. I mean, this is a common, you know, problem that you see even in the 30s and 40s. And again, there is genetic tendencies toward this. You know, some people don't get looseness around their eyelids their whole life, which is great, but most of us unfortunately have different genetic cards, and we do get some heaviness or wrinkles or dark circles or some of these changes. So yeah, it is one of the first things that people come in to see us for, because they start to see hooding, extra skin, dark circles, crow's feet, wrinkles. I should mention that the crow's feet, you know, are fairly easy to treat just with Botox. So that's another common thing in a younger person who might have crow's feet and dark circles. We do a little Botox, fill in the dark circle with a filler, take away that, and you can really make the eyes look a lot nicer just in the office. Well,
and I think it might be important to mention the difference between Botox and fillers as well, because they do completely two different things, but sometimes they're said together, so I don't know if enough people know that.
Yeah, so they're so often done together that there is some confusion there, but Botox really is botulinum toxin type A. It's a neurotoxin. That sounds scary, but it's really just a protein that blocks the conduction between the nerve and the muscle. And when it does that, it relaxes the muscle. And many of the creases we see on our face are from muscle activity. So frown lines between our brows or crow's feet, if you just put a little Botox in there, it'll relax the muscle, the crow's feet just disappear. And so it works really nicely to soften lines and creases. Fillers are actually substances we inject into the skin or beneath the skin to physically change that area or augment an area that's been where fat has been lost. And in the lower eyelid, the dark circles are often caused by volume loss, fat loss. We lose fat from our face with age. The cheeks tend to sag, and the first area that shows up are these dark circles under our eyes. And so that's a common area, and putting just a little bit of filler in there doesn't require very much, can fill in those dark circles and really give them a long-lasting improvement.
Well, that's why it really does kind of feel like an art form to me, to know of what to use of this, what to use of that. Each person is different, each eye is different. I mean, no procedure is the same, I'd imagine.
That's absolutely true, and you know, that's what makes the job fun and interesting, the nuance of it, you know, the subtle differences between one person and another, you know, ethnic differences and gender differences, and so all that gets factored into what's going to be the best solution for each patient.
Well, and then that goes back to making sure that the person still looks like their, you know, best kind of natural self, right? I mean, you're just kind of enhancing, you know, what they already look like.
Exactly. And eyelids are great that way because we don't start with heavy eyelids. They come over time. And when you can just kind of remove some of these changes, like the hooding of the upper lid or the fat pockets in the lower lid, or erase those dark circles or soften the crow's feet, we just make people look younger, healthier, a little more vital, more bright-eyed, which is nice. You know, take away some of that heaviness that tends to make us look tired or unhappy. So it can be really effective.
Do you ever get surprised by some of the results you see and how good of a job that you do? And certainly, I mean, because it is so fun to see the before and afters and how it really can just change a person's, you know, attitude at life again.
It sure can, and yeah, that's the real reward of the job, of course, is you know, getting great results, seeing people, you know, look great and feel great, and you know, it does give people a real lift when they have something done where they look better. They can look in the mirror each day and say, "Wow, I really like the way I look today." You know,
I
not
liked
be
that
bothered.
pun.
Yes,
That was perfect.
Right. Well, that's where it came from. Look and
Yeah.
feel your best.
So if someone is watching today and they're going, you know what, okay, you know, this is something I've been thinking about or wanting to know more about, I mean, what's your take home? What do you think they should know when it comes to their eyes?
Yeah,
and
I
their
think.
options?
Well, I think, you know, a consultation is always really helpful. I mean, it's not scary. You know, it's just a chance to look. And you know, in our office, when I do a consultation, I'll look at everything: the skin, the bone structure,